Hi, my name is Kristen. I live in Columbia, Missouri, and I have postural orthostatic tachycardia syndrome, POTS for short. POTS is a kind of dysautonomia, a dysfunction of the autonomic nervous system. In my case, that means that my circulation system doesn't function the way that it should, or doesn't function optimally. And there are many symptoms, including dizziness, fainting, fatigue, migraines, digestive problems. But fortunately, because I have access to health care, I'm able to take a beta blocker and a vasoconstrictor, both which enable me to function throughout my day. So the thing is with POTS, it's very different depending on the individual. And really what doctors recommend is exercise to train your body and also relaxation. The issue is that the condition is so deteriorating physically and psychologically that often patients on their own are not able to do this regimen. It's just, when you're sick and you feel awful, you feel frustrated, you feel afraid, you feel anxious. That's just a natural response to those symptoms. Yeah, it's not something that people can do alone. I was fortunate because of insurance to be able to go to a pain rehabilitation clinic back at Mayo Clinic in Rochester, and I basically had a team of doctors that were dedicated to supporting me in practicing this regimen, as well as other people with chronic illnesses who, were kind of in the trenches with me. And because of that, I was able to kind of develop a lifestyle and habits that allow me to cope with my condition in a way that I'm still functional and I have, a decent quality of life. However, I would not have been able to do that outside of that medical setting. And so I think of a lot of people who have this condition who don't have insurance. And it's really easy to say, just exercise, just eat right, but you're telling them to do everything that their body and natural instincts and their symptoms are making it so incredibly difficult, borderline impossible to do. And I really wish more people could have access to this clinic, because it's not something you can pay for out of pocket. I will say that. Knowing that the Attorney General is trying to take away protections for people with pre-existing conditions makes me feel numb, really. It's not really a hypothetical for people with pre-existing conditions. It's not something we can say, oh, that's going to happen to somebody else, but not to me. That's something that will impact us directly. My grandma passed away when she was 54 because she didn't have insurance. She'd worked really hard her whole life and just had a really hard life, and she went to the hospital with chest pains, and the doctors at first were saying you should probably stay here for observation, and it came out that she didn't have insurance. They left the room and they came back and they told her, you're fine, it's probably just a cold. And the day after Christmas she died of a massive heart attack. So I've seen what happens when you don't have insurance. This is not a comfort issue. This is a life or death issue. And I feel that when you're attempting to take away that access to life from a specific group of people, that it's cowardly. It's really disheartening, because I feel like, is that really what we've come to in the United States? Is that who we are, and is that who we want to be? And I hear people say, oh, it's more expensive, I don't want, and that makes me sad, because are we really a nation where we value a person based on how much money they represent to us? Is that what we see people as? We don't see them as individuals, we see them as a dollar sign, and I don't want to be that way, and I refuse to be that way.